Hello, I am Dr. Syed Shabbir. I'm a neurologist and an epileptologist. I am the director for epilepsy and the medical director for the EEG Lab at the MedStar Franklin Square Medical Center. I'm also an assistant professor at the MedStar Georgetown University Hospital. I see patients with all neurological conditions. I do have a special expertise in epilepsy. I have also interest in multiple sclerosis, in dementia, in headaches and migraines, in strokes. Those are the important key kind of conditions. Unfortunately, neurological conditions can be progressive, they can be chronic, and they can obviously affect patients in significant ways. I might see patients after they've had a stroke, which can be sudden, which can be devastating. I may see patients because they're going through a more progressive and relenting course. I may see patients if they've had their first seizure, or they might have had a history of seizures, a diagnosis of epilepsy, but they're not well controlled. Obviously, all of these conditions can affect patients in all walks of life and all stages of their life. And my goal is to try and help them with these conditions. During my years in practice, I have seen a lot of tremendous changes in the field of neurology. We have better diagnostic modalities. We have advanced imaging techniques like MRI. We have techniques that are more widely available, like the electroencephalogram, which is EEG for short. What these new diagnostic testing allows us to do is to be able to diagnose patients more accurately, more quickly, and treat them more appropriately. I was always fascinated by the brain, by the complexity, by the intricacy of the brain. Arguably, it's the most complex organ in our body. I wanted to learn about it more. It controls everything we do. It controls what we feel and how we feel and what we process. And obviously, the medical conditions that can affect the brain can change who you are as a person. And that was incredibly fascinating to me. So I find my job to be very gratifying because neurology and neurological conditions can be very complex, very difficult to diagnose. We don't have simple testing, simple blood work, simple imaging that comes back and gives me a diagnosis. So that's where the art of medicine is important. That's where being a good clinician is important. That's where listening to patients is important. And so I find it gratifying if I'm able to help patients with their diagnoses, to help them with their treatments, and hopefully help them with their medical conditions. And I find that to be the most rewarding, gratifying part of my job.